Hi, this is Dr. Moubayed, and today I'd like to talk to you about the temporal lift. You've probably seen the fox eye trend on social media, where celebrities lift the tail end of their brow using threads. We perform a surgical procedure where we elevate the side of the brow in a more durable way, and it's done under local anesthesia, and it's called the temporal lift. The main benefits of the temporal lift is that there's no visible scarring, as the scar is hidden behind the hairline. It provides more durable lift of the brow, and it's done quickly under local anesthesia with a quick recovery. A good candidate for this procedure is somebody with low lateral brows that do not respond to neuromodulator treatment. Also somebody with a short forehead with good skin laxity so that the brows can move. The surgery is performed in the region where a branch of the facial nerve passes, which is why it's important to pick a surgeon that is well trained in facial anatomy and facial surgery to minimize risk of injury. Two alternatives to the temporal lift are either neuromodulators for non-surgical brow lifting or thread lift. The two most common procedures that we combine the temporal lift with are the upper blepharoplasty or a forehead lift. So how does a temporal lift happen? You first come in the day of the procedure and we put in an IV so we can give you medication like sedation. We then precisely mark out the vector where we want your brow to lift, and we decide this together by looking at a mirror and drawing on your face. This is an indirect lift, meaning that the scar is away from the area being lifted, so we hide the scar behind the hairline. We then inject some local anesthesia with tiny little needles, just like at the dentist, so you don't feel a thing during the procedure. We then disinfect you and proceed with the surgery, where we resuspend the brow to a deep layer of the scalp called the deep temporal fascia, and then put staples above it. We see you a week later in clinic to remove your staples, and at that point, most of our patients are very presentable. The best way to get ready for a consultation is to know that there are many ways, surgical and non-surgical, to treat the eyebrows, and it's always better to consult with somebody that can offer you treatment that is surgical or non-surgical that's adapted to your needs. Most patients are very presentable after 1 week. Surgery on the brows does not prevent the face from aging, and you should expect the results to last approximately 5 to 10 years, but we recommend maintenance with neuromodulators to optimize the duration of your result. Most of our patients tell us that this procedure is not painful at all, either during surgery or during the recovery process. This is Dr. Moubayed. Thank you for watching. If there's anything you'd like to know, drop us a comment below.